Good day. I'm Kate Ian Amberlis, your student nurse from Nueva Ecija University of Science and Technology. Today, I will be demonstrating assessing vital signs, namely temperature, pulse rate, respiratory rate, and blood pressure.
Assessment. We should assess any clinical signs and symptoms affecting vital signs. Cite most appropriate for measurements of vital signs. Factors that may alter the vital sign: skin and mucous membrane color, position appropriate for procedure, activity tolerance, chest pain, dyspnea, sign and symptoms of hypertension or hypotension, factors affecting blood pressure. Determine the policies and procedures for the facility. Determine the client's record for medication that may increase or decrease the vital signs. For the planning, assemble equipment and supplies. First, we need thermometer sheet or cover, disposable gloves if necessary, tissue or wipes, watch with a second hand or indicator. If using Doppler ultrasound stethoscope, obtain the transducer probe, the stethoscope headset, transmission gel, and tissue or wipes, stethoscope, blood pressure cuff of the appropriate size, and sphygmomanometer. Implementation. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. First, we need to greet the client, state your name, verify the client, explain the procedures to the client. I have explained to the client what are we going to do, why it is necessary, and how she or he can participate. Wash our hands and observe appropriate infection control procedures. Provide client's privacy. Place the client in the appropriate position. For the temperature, clean the thermometer first. Get the alcohol swab. Open the alcohol swab pouch. Discard the pouch on the side. Get the thermometer and clean it, start to the tip up to bottom in a circular motion, and dispose the alcohol swab. Greet the client and state that you will start the procedure. First, place the thermometer to appropriate root and site. Wait the appropriate amount of time. Electronic and tympanic thermometer will indicate that the reading is complete through a light or tone. Once you hear the beep sounds of the thermometer, you can now remove it and check the temperature. Read the temperature and ipakita ito sa pasyente. And now, it's time to clean the thermometer again. Start to the bottom to top. Clean the thermometer in a circular motion. If the client temperature is obviously too high, too low, or consistent with the client's condition, recheck it with a thermometer known to be functioning properly. And next, we need to assess the pulse rate. Select pulse point. Palpate and count the pulse. Place 2 or 3 middle fingertips lightly and squarely over the pulse point. If the client's pulse for the first time, when obtaining baseline data, or if the pulse is irregular, count for 1 full minute. Test the pulse and rhythm of the volume. Tell to the patient his pulse rate. And next, we need to assess the respiratory rate. Observe and palpate and count the respiratory rate. If you anticipate the client's awareness of respiratory assessment, place a hand against the client's chest to feel the chest movements. While breathing, or place the client's arm across the chest and observe the chest movement while supposedly taking a radial pulse. Count the respiratory rate for 1 full minute or 60 seconds. An inhalation and an exhalation count as one respiration. Observe the depth, rhythm, and character of respiration. And the respiratory rate of the patient is 18, it is normal and is not shallow. And lastly, we need to assess the blood pressure of the patient. The adult client should be sitting unless otherwise specified. Both feet should be flat on floor. The elbow should be slightly flexed with the palm of the hand facing up and the forearm supported at the heart level. Expose the upper arm. Always tell to the patient on the procedures that you will going to perform. And wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cuff approximately 2.5 cm or 1 inches or 2 or 3 middle fingers above the antecubital space. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with the fingertips. Close the bulb on the pump by turning the knob clockwise. Pump the cup until you no longer feel the brachial pulse. At that pressure, the blood cannot flow through the artery. Note the pressure on the sphygmomanometer, at which pulse is no longer felt. Release the pressure completely in the cuff and wait 1 to 2 minutes before making further measurements. Position the stethoscope appropriately and cleanse the earpiece with alcohol or recommended disinfectant. Insert the ear attachment of the stethoscope in your ears so that they tilt slightly forward. Ensure that the stethoscope hangs freely from the ears to the diaphragm. Place the bell side of the amplifier of the stethoscope over the brachial pulse. Hold the diaphragm with the thumb and index finger. Pump up the cuff until the sphygmomanometer reads 30 mm mercury above the point where the brachial pulse disappeared. Release the bulb on the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm mercury per second. As the pressure falls, identify the manometer reading. Deflate the cuff rapidly and completely. When the device has determined the blood pressure's reading, note the digital results. Remove the cuff. Wipe the cup with a approved disinfectant. Evaluation and documentation. Document the data you get at temperature, pulse rate, respiratory rate, and blood pressure. In the vital signs record sheet, report abnormal results to the primary care provider. Document the procedures in the client's record.
And that's it. That was my video on how to do assessing vital signs. Again, I'm Kate Ian Amberlis, your student nurse from Nueva Ecija University of Science and Technology. Good day.